This is Dr. James, and I was asked what I think of the oxygen monitoring devices that you can get for babies, like the Owlet, and there's other little bracelets and things. And I'm going to go back 26 years ago to when I was in training, and we would have things called CR monitors. This is cardiac respiratory monitors. And they would actually have a strap around their chest. And these were babies that were brought to the hospital because they'd stopped breathing. At that time, it was called an ALTI, an acute life-threatening event. They had turned blue. They might have had needed some resuscitation, and they'd had a hard time breathing. And so we would send them home with a CR monitor. And an attending of mine said that a CR monitor had never saved a single patient's life, but it had kept a lot of doctors from getting sued. And I thought that was interesting that we were doing that over and over and over again. I've ordered hundreds of CR monitors, but probably hadn't saved a kid's life. And that's kind of what these monitoring devices do. A lot of babies with SIDS die because of improper sleeping techniques, not using safe sleep, or they die from problems like undiagnosed metabolic diseases and things like that. And I think that's probably what he meant, is that these things that you were going to die from, like metabolic diseases, that monitor wasn't going to keep them. When they died, they just died and you couldn't bring them back. On the other side, when you're practicing unsafe sleep things like falling asleep in the wrong places or on you or in bed, a lot of times you didn't put the monitor on them because you all were so tired you just fell asleep. And so they're not going to help with that. I know the Owlet, the FDA had made them change things because it had not been tested as a medical device, and therefore, they couldn't make some of the claims they were previously making. This is what I tell parents. I tell parents, they go off a lot. There's a lot of false alarms. There's a lot of people that end up in the emergency room or in the doctor's office unnecessarily because these are going off. And when they go off, they panic people. But on the other side, if you sleep better because of it, and if you feel rested and more calm as a parent, then it's probably worth it. So would I trust my life on them? No. Would I bet that they're going to save my baby's life? No. But if you feel better and more comfortable and you can sleep better and you can be a better parent, well, then by all means use one. Just make sure that you use it and you use it safely, that there's not any loose cords that can get tangled around the baby. There's some studies that have shown like the radioactivity, the radio waves can somehow cause problems. I think we're around those all the time through cell phones and everything else and Wi-Fi. I don't know that I necessarily would worry about that so much with these devices enough to not use them. So I guess my advice is, if they make you feel better, by all means, feel free to use them.